Welcome back to Just Saying. Today's conversation is one that blends heartbreak, hope, and the incredible power of a mother's determination. My guest, Jeaneen Tang, is not only a speech-language pathologist, but also the mom of Che, a resilient 12-year-old who survived a brain injury and stroke before his second birthday. Doctors said he may never walk or talk, but Jeaneen's knowledge, persistence, and unconditional love helped prove them wrong. We're going to talk about her journey, the role of speech and language pathology in development, and what every parent can do to give their child the best start. Get ready. This episode is about courage, healing, and the miracles hidden in everyday moments. Let's dive in. Hey friends, welcome back. Today I'm here with Jeaneen Tang. She is a language pathologist, speech and language pathologist. She's a mom, and I can relate. I'm a mom, but we're here to talk about some mom things and some speech pathologist things. But because Jeaneen, I want to talk about my daughter, so I'm going to use you to help me. But right now we're going to talk about your son and some things that happened to you. And welcome to the show.
Thank you for having me.
I rambled. Okay. So, this is just a conversation with moms, because I swear I know that I have been in your shoes, and, I mean, not exactly, but I have been in your shoes, and I can tell you that your story is it's very gripping. And so I really want to get into it because I want everybody to hear your story. But let's go back. Tell me a little bit about how you became a speech pathologist. It's speech and language, right? Am I saying it correctly? Speech and
Language pathologist.
Thank you.
Language pathologist.
I'll always
Absolutely.
mess it up. I swear.
It's a really long name. It's a really long title.
My goodness. But every time, I love your last name though, because I was telling you about this before when we were off air, but your last name is Tang, right?
Yep.
But every time I cannot say your name without Tang popping into my head. And in fact, I just purchased myself some from Sam's Club because I saw a drink. There's a drink you can make with Tang. And I was like, I haven't had Tang's 25 years. So anyways, I'm sorry. I totally digress. But anyways, let's rewind a little bit. Sorry. And I know I'm acting a little nutty, and I was telling you off air that I've been off my camera for a couple weeks, and so I'm a little rusty. So all my friends out there are like, Jessica, stop talking. But okay, so let's rewind a little. Tell us a little bit about your journey on and your education and the type of jobs that you've done. I know you said you worked in the school system for a little while.
Yeah, absolutely. So when I was growing up, I really didn't know what I wanted to do. And I thought I would want to help people because when I was 8, my grandfather had passed away and I felt really helpless. So I thought I'd be a teacher. And in high school, I played a lot of sports. So I thought maybe a physical therapist, right?
What sports did you play? Sorry.
I played volleyball, basketball, and gymnastics and cheerleading.
Oh,
yeah.
Wow, gymnastics.
Yeah.
That's hard to do. My best friend was in gymnastics. She did well. We didn't have a gymnastics team, but she did it when she was younger, and she was really talented. But anyways, I'm sorry. I just like to see what other people do play, because I did basketball, cross country, and track. So I played those things, kind of different sports, but I mean, I did the endurance thing. But anyways, I digress. Please keep going. I didn't even, I'm just curious.
No problem. Absolutely.
Okay, sorry.
Thank you. I love the questions. I love them.
Okay.
So I knew I wanted to do something that would require a master's degree, because physical therapy, you needed a master's at least at the time. So I got my undergraduate degree in English literature and creative writing. And when it came time to apply to grad school, I was like, do I want to do physical therapy, or do I want to get an MFA and be an English professor? And then someone popped into my head, have you thought about speech therapy? And I was like, what is that? Because I didn't need speech therapy. I didn't know anybody personally that needed speech therapy. But when I looked into it, it seemed like a really good profession that kind of aligned with the English literature, right? Communication, language, and helping people as well. And so my University of Hawaii at Manoa, my hometown of Honolulu, Hawaii, they had a program for master's degree in speech language pathology and a minor in audiology. And they were also, the Department of Education was desperately looking for speech therapists. So at the time, they were offering stipends to students to go to grad school and work for them for 3 years. So It was like a no-brainer, right? It's like, you're like,
So this
"I'm gonna
wasn't
get a guaranteed job."
Can I ask you a
Yeah.
question? Okay, so my husband is a physical therapist, but his is a science degree. So yours is English or is it
It So mine was a English literature and creative writing was an arts degree, and then speech language pathology was a science degree. Yeah.
okay. I
But
was
I
just
knew
curious.
Yeah, I knew I wanted to go into a science route for grad school, so I had taken a lot of science in undergrad along with my English. I probably
Oh,
took
science.
way too many credits every semester. It was too many credits. It was crazy. But
Overachiever.
I know. And so, I had a guaranteed job after grad school. I got a stipend for school, so it was really a no-brainer. And I'm so glad that I went that route because I did work in the schools for 4 years in Hawaii. And then I decided I wanted to be an actor, and I left Hawaii to go to Los Angeles. And I thought, okay, well, I'm just going to be a waitress and be an actor. And then I'm like working 60 or 70 hours a week. And I'm like, I am dying working so much. So I'm like, let me get my license in speech therapy in California, which was very simple. And so I got my license and I worked in the schools in California part time and made enough money to cover what I was working in at the restaurants 60 or 70 hours a week. So working part time doing speech therapy, trying to do acting as well. And then I switched over to early intervention in 2010, which is 0 to 3 years old. And that's
Did you
working with,
were you in anything? Did you do a commercial or anything?
I did some co-stars. So if you look me up on like IMDb, I did a few co-stars on like um, Days of Our Lives and
Days.
yeah, and some other small things. And the biggest thing I did was probably theater, where in Los Angeles we did the Joy Luck Club, and I got to play Waverly. I don't know if you've seen the Joy Luck Club. She's the bitch of the Joy Luck Club. So it was
Love
really
it.
nice to play the bitch. It was.
I mean, was that like your dream? Like that was your dream. You had a calling, right? But then that's what you ended up doing, but you had a dream to be an actress, right?
Yeah, and I still act when things come up, right? So I had an audition like earlier this week. I still have auditions every year, but it's not it is my passion, but it's not my main focus.
Just think if you land a few, you make some bank, you know?
Yeah, I know. I know. From those co-stars, I'll get money every year, as long as they're, re-signed for some different network or whatever. We'll get a
Yeah.
little bit of money every year, which is great.
Well, let me just tell you, if my book ever makes it to Netflix, I'll hire. Well, I'll tell them. I go, you have to have her, Jeaneen Tang
Oh,
as my on in my.
amazing.
I'm just saying it's not going to ever happen. But let's speak it into existence, okay?
It should. It
Okay.
should.
So
Yeah.
I'm sorry, I took you off path. So now you're doing intervention, early childhood education, well, early childhood intervention, correct?
Yes, early
Okay.
intervention speech therapy since
Okay.
2010. And I have been doing adults, I've been working with adults in the hospitals as well. So I
Does
love
that look
different
like? What does
populations.
that look like in the hospital? Is it like when they are stroke victims, or how does that? What does that look like in the hospital?
Yeah, so we will mostly do like swallowing evaluations and some cognitive rehab, speech and language assessments from either having a stroke, having a traumatic brain injury, any kind of altered mentation, whether it's from like an alcohol or drug abuse thing, or from some other things. Maybe they had seizures and they're altered. Anything that would create difficulty with coordination of swallowing, or difficulty with remembering or being able to express themselves. Yeah.
Yeah, like right before we had talked a while back, but my daughter had a swallow study or a swallow test. She had one when she was little, and they said, "Oh, she's fine." And then they did another one because she won't eat anything that's not liquid, like pudding. She'll have pudding and maybe mashed potatoes is the thickness she'll do, but like not with lumps. And she'll do soup and anything with that's creamy. She won't put anything with texture in her mouth. And so we thought that maybe she was because she's afraid to swallow. It's mental. She is afraid to swallow. And so and I was telling the lady, I'm like, something's wrong with her. She can't swallow. She won't swallow anything that's not like so they had her eating applesauce and they had her some other different consistency pudding and stuff. And they're like, well, she can swallow that. She doesn't have a swallow issue. It's a mental issue. She has a textured version and it's called aphid. But I have to have her, that has to be diagnosed. It's my diagnosis, but it has to be diagnosed by, I guess, a psychiatrist or something. But anyways, I had thought for the longest time that it was a swallow issue, but man, you guys know your stuff. You're totally
Yeah.
nope, nope, no, 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 no. And but
Yeah.
my daughter too has language issues. She has a high vocabulary, but even now she's 15. I cannot understand her at all, and it's actually getting worse. Why is that? She's had speech and language at school for I don't know 3 days a week for since she was 3, and now that she's 16, I don't know if it's because she's talking faster. I'm thinking, but I can't really understand anything she tells me, and it's almost like just get your phone out, Piper. I can't understand you, and I feel terrible. But like, d why isn't she getting better? Like, why aren't these, like, isn't there a point where they're supposed to get better?
Think so, right? Yeah, like there's some pacing issues, maybe carry over, especially when they become like teenagers. They don't really care as much to correct it.
Right.
They're like, I'm gonna talk. Like um I have a friend who her daughter has a lateral lisp, but now she's like, president of her school and she has to do all these speeches. And she's gotten a little bit better because she has to do a lot of speeches, but she still doesn't really care that much. Does that make sense?
Yeah,
Uh,
like, I think that's Piper too, because she leaves off the beginning and the end of her words. Like, she was trying to tell me today sports jersey, and I could not. I mean, there's no way what she was saying was anything near sports jersey. And that sounds like a hard word to say, actually. And she typed it on her phone. I was like, okay. So we put her in we have a old jersey from Bad News Bears. So that's what she wore. She wore a Bad News Bears jersey. But anyways, I'm sorry I got you off topic, but I was just wanted to bend your ear a little bit, like I said earlier, because I'm just don't know why with all this that she gets it in school, which, I mean, they've got it nailed down to like they know her in the IEP, they are spelling it out and I can see exactly what they're saying. Like they are right on the money with, diagnosing her and how to help her. But maybe it's just that she doesn't care, like you said.
Part of it. And then, the speech therapist should be sending home strategies for you guys to carry over at home. So the
Yeah, that's not happening.
communication, I think probably the communication needs to be increased between you and the speech therapist. Specific strategies and what they're doing and if they work in the therapy or not, right? So maybe they're doing something but it's not really working. Maybe they need to try something different and
So in her
try.
IEP, that's what I'm going to do is I'm going to ask that there's more communication between, because I feel like that we're going backwards and she's not getting better. I don't know. I just I don't know how she's going to be able to walk through life where she cannot talk. Like, who's going to hire her?
Yeah.
I know that sounds terrible, but I'm like, she can't even say burgers and fries. You can't even say the words. If that's the kind of job she's going to get, I don't know, but she can't even say enough to be able to work. Ugh, I'm sorry. I just totally can't help myself by asking these questions because as a mom, how like when you worry so much about your kid, it's like that they're just totally on your brain. Let's back off my story and let's get back to you. So, early intervention, you're working with kids, and I'm so sorry that I did this to you. You're like, why am I on this girl's show? My Lord. But let's get back. Okay, so back to the story.
Okay, so we will return to your daughter, maybe
Okay.
off the show if you want to
Okay.
talk more about it. 'Cause I have some
Okay.
ideas. Have some ideas.
Okay.
Yeah, so early intervention. I work with the kids in school age as well for private therapy, and then I do adults in
Oh, that's
hospitals.
right. You're on the
Yeah.
adults. I wanted to know about the
Yeah,
adults because
the adult
I was
stuff.
just curious, like, what is that? Like, how does that materialize in a hospital setting? But yeah, I can see like if they're having epilepsy or they're having some sort of neurological thing that happened to them or something, and especially there are some people that do heavy drugs and they don't come out of it very good, especially that fentanyl. Like, oh my Lord,
Yeah,
these
we have a lot
people.
of people with like psych issues as well. And sometimes, they order a swallow evaluation for the patient, but it's really a psych issue versus a swallow issue, right? So there's all kinds of things. And, I'm in Los Angeles, so a lot of drugs at times. People that come in for drug
Uh,
overdoses and we've seen everything.
yeah.
So it's quite a challenging area to work in, but interesting as well. I love it. I love
So you
both.
got so you got married, right?
Well,
Or
I
no?
didn't get married. I just had a child.
Okay, you got okay. Well, we
So
do that
I
in
had a
America.
baby daddy. Yeah. Yes,
That's
I
okay.
know. I know in America.
Shoot, I'm all for that. I just so happened to landed my guy, and he knows it's cheaper to keep her. So we've been together 28 years, but it's only, by the grace of God, my Lord. But I know a lot of people that have baby mommy or baby daddies, and I love it. It's all good. But I'm sorry that I that
No,
I
that's okay.
assumed it.
A lot of people get married. I'm kind of glad we didn't get married because I think we've grown to understand we're not each other's people, but we are the parents of our son, which is great. And I think that you know, when I'll go into my son right now, but my son has two parents who have great strengths and in different areas. And so we can kind of work on our son in different
Like a
ways.
tag team.
Yeah, to make him
Right.
as whole of a person as possible.
Right.
Right. So, Serge is his name, is his dad's name. And we had dated from 2005 to 2009. We had broken up and then dated again. And then by that time, I was about 35 or so. And up to that point, I didn't know if I wanted to have kids because, I worked in the schools for so long that I'm like, this is really great birth control because you're working all day and you're like,
It's so different when
I
it's
do.
oh no, let me tell you.
I know, I know. So, and I had nieces and I love my nieces. I love being an auntie. And then, you hit 35 and you're like, is it time to have a kid or not? Or am I not going to have a child? And so we kind of talked about it. Serge has an older son who's 16 years older than our son. And we decided, okay, let's try, we'll see if we can have a baby. And lo and behold, we got pregnant, had a child. And our son Che, he's amazing. He was a gigantic baby. He gained over a pound a week for 8 weeks. And, by the time he was 1 years old, he was like 26 pounds or something. So he was a bigger baby. And unfortunately, when he was 13 months old, when he was toddling, I gave him a bath. I put him in his towel, put him in the middle of the bed, and I was like, I forgot the lotion. So I literally turned a few feet to go grab the lotion. And because he was at that toddling age, I believe he's just tried to come after me to get me or something and fell off the bed. And even though the bed was just the box spring and the mattress, which was, we measured it, it's 18 inches off the ground. The way
Right.
he fell was just perfect enough to give him a large brain bleed.
Mm.
And, he cried for about
Everybody's
a
kid
minute.
falls off the bed or the couch. My son fell off the couch,
Yeah.
rolled right off. I mean, literally when they just move a smidge and I'm sitting right next to him and he fell right. I mean, of course, what do you do as a mom? You freak out and you cry and you're like, oh my God. Like, I mean, I can relate. And every mother, almost every mom, their kid has fallen off the
Yeah,
couch or the bed.
and there was no scratch. There was nothing to indicate that there was an injury, right? He cried, and then he just passed out. He just became silent. And his dad was in the next room, and we're like, "What do we do?" He's like, "Let's go to the hospital right now." So we drove to the hospital. It was about 10 minutes away, and we probably got there in like less than 8 minutes or something because he was, in a hurry to get there, obviously. And, you go to the emergency room, and the front desk is like, "Okay, well, just sit down and wait," right? So I know. So there was a nurse that was up there and was like, "Oh, he's not awake?" And I go, "No." And they're like, "Let's get him in right now." And they did an emergency CT of the head, a CAT scan of the head, and they saw the large brain bleed. So they said, "We're going to have to do an emergency craniotomy." And they were literally intubating him, getting our signatures for the craniotomy. We're watching him, getting prepped. And because I worked in the hospital, I've learned to put up this screen of
Like,
like,
you're not desensitized to it, but you're kind of like I get what you're saying, like, my husband too is like, "You're overreacting, like, relax, it's not gonna be, and calm down," and that's his way, 'cause he works in a hospital, and that's how he is level-headed, and he's thinking things through, and how I can see what you're saying, like, you're just like, I kinda see what you're saying, like, you're kind
yeah,
of I mean, I know you're probably internally freaking out, but that maybe it wasn't coming out outwardly that way. Does that make
Yeah,
sense?
because it was, like, unbelievable. I'm like,
Yeah,
he just had a small fall. They're telling me this has this huge brain bleed. I'm in shock. I'm in disbelief in a way.
yeah.
Don't know what to feel, and I'm trying to just kind of hold it together because at that point, his dad's, like, down the hall, like, breaking down, and then, I'm watching my son literally get intubated to get taken off to surgery, and the social worker came over and was like, "Do you wanna sit down and talk?" And I said, "Can you please give us a minute?" And in her report, she wrote that I was a cold-hearted mother because I was not breaking down and crying in that moment. And, I had cried so much since that point that, I'm a very emotional person. I will cry, I'm watching The Wild Robot, I'm, like, in tears. Just like I cry at commercials, all these different things, but in that moment, I was not crying, and it was just very uncharacteristic of me, to not be crying because
Right,
I'm
you
so.
probably were in shock. I mean, I
Yeah,
think that's the best way to explain it. Yeah, you've got training and yeah, you worked in a hospital, but I don't think I think it's just you were in, like you said, disbelief. Like, this isn't happening. Like, oh my gosh. You know what I mean? Like, man, I just feel for you.
yeah,
I can't
thank you.
believe and that called you that either. By the way, they are always wrong most of the time. Like, oh, not that that's not true. But I hate to say that, but I'm just saying, like, sometimes they don't get it right. I
Yeah,
don't
a
know.
lot of times they don't get it right, and by the time 24 hours pass, even 12 hours pass, we already talked to doctors, we talked to social workers, we talked to cops, we talked to detectives, and then they're like, "Oh, we think you tried to abuse your child." I'm like, "What?" It was crazy. So in that process, we lost custody of our son because they
Oof.
thought we tried to purposely hurt him or try to kill him or something. And it was 20 months until we got custody back. But fortunately, his paternal grandmother was able to take custody of him. And because dad and I did not live together, uh, and grandma and dad had a duplex, they had a property together, that grandma could have our son and then dad could stay at my place because for a while, neither of us could stay with him. But for
So he couldn't even live in his own place because it was too close to his mom's house.
yes, yeah, for a little bit, for a little bit. So
They forced you guys to move in together, like, that's
yeah,
crazy.
but,
I wanna
yeah,
interject. I had a good friend, and, her husband at the time was swinging the kid around, and I think the baby was, like, not a baby, it was, well, 18 months or something, and they were playing, and he was swinging him around, and he broke his legs. Or broke a leg or something, and they took the baby away, and then they made him move out, and because my friend, she's like, you move out because I'm getting the baby back, you know what I mean? Like, I don't care, you go. But yeah, he broke the leg, and it was an accident, and it wasn't like he was abusing the kid, but he was being not careful because sometimes dads are, they think that the kids are made of steel, you know what I mean? And can you imagine that though? I mean, you can imagine 20 months is a super long time. Like,
yeah,
I
yeah,
mean,
yeah, and
God,
then, I mean, thankfully, while he was in the hospital, the judge, because at first they didn't want us to be in the hospital with him. They took him out of the PICU, the pediatric ICU, I think too early, and I wanted him to have somebody there. I'm like, "Can you put a volunteer or a caregiver?" My brother had flown in from Hawaii, and they wouldn't even let him be there. I'm like, "He wasn't even here when my son got hurt?" And they said no, and so we had left for the day, came back the next day, and they're rushing him back to the PICU because he had a stroke. So I just like my mother heart tells me like he knew he was alone, and it just
yeah.
they should have kept him in the PICU, especially if we weren't going
Understand
to
why
be
they
there.
didn't contact, like, the people that are around in your life and, like, take statements from people that know you and that have seen you with your kids. I mean, and doctors. And I mean, is that something you had to do, is like give affidavits from like your doctors and all the different people that are in your life?
They didn't ask for any of that or accept any of that kind of suggestion.
What?
And yeah, for 3 months I got to live in the hospital with him, spent every night with him, except for one night when his paternal grandmother was like, "You need to go and sleep in a bed and
And
not
take a
in
shower.
this crazy
Oh,
chair."
right.
Yeah, yeah, yeah. I would
Yeah.
leave and I would come back and every night, and for 10 months, I wasn't allowed to be alone with him, which was crazy. And because I live about a mile away from dad's house, I would wake up before my son got up in the morning. I would drive to the dad's house where grandma was watching him. And, after a while, dad was able to live with him because he wasn't in the room with him, right? So he wasn't the offending parent, so he could live with him. So I would go over there before I went to work because I eventually had to go back to work. So I would go over there and feed him, go to work, and then come back, feed him dinner, put him to bed, go home. And I would do that for months until I was able to be alone with him again or live with him again. And I don't know how I did that. It's crazy to think that we did that for so long, or I did that for
And
so
then
long.
this is important time of your baby's life. It's the very beginning when they are, imprinting on you as a mom, and can rely on you and need you. And especially, now he's going through some physical issues. He definitely needs his mommy. Like that is not something that's why the system is so screwed up. Like they don't realize that you're actually harming the situation. And I don't know. It just drives me. I'm in disbelief. Like I can't believe your story. It is almost too crazy to be true that they took that long to figure out whether or not you're going to harm your child. Like, almost 2 years. That makes no sense.
Yeah, I think the judge always knew that we were not guilty of doing that. And, our my lawyer, they wanted to not have me reunited with my child. What the DCFS did not want me to have any reconciliation or be reunited with my child. They wanted to not for me to never have my child back. And my lawyer, I don't know if it was the right advice. She said to plead no contest rather than not guilty. But it's the DCFS. I thought it would go faster. I thought that that would make the process go faster,
Now,
but
does
it
that affect your
didn't.
job? Does that affect your
It
job?
it
And
didn't affect my job, which was I'm thankful for because I do
yeah,
work with children.
right.
But part of the whole program was I needed to go to parent counseling, which is great because in a way it was like getting therapy because at
Right.
that point I needed therapy.
Right. Yeah.
Right? So I got to work with, one of the clinical psychologists or social workers, and he knew Che from the whole, court system. Like, he had to work with Che, he had to work with me. So he knew me, he knew I wasn't this evil mother that was trying to harm
I can't believe
my
they didn't
child.
allow you to have like evidence of like your pediatrician and all the other doctors and all the other things that because you take your kids to see for checkups and wellness checks and all the different things and they wouldn't let you like at least try to prove that you're not this abusive person. And by the way, like I said, kids roll off the bed, they fall off the couch, or they roll, they do those things. It happens to almost every parent. I'm not kidding. Like I think both my kids it happened to me. They both kind of rolled off the couch and I caught one. I was like, "Oh my god, don't do that." But I mean, that this is something that happens to a lot of people. Oh my gosh. I'm sorry. I'm just cannot believe it. And I just feel for you. So he was able to leave the hospital but you still and he was when he left the hospital, I mean, what state was he in?
I mean, he was just kind of walking. So he was able to walk a little bit. So he took his first steps in the hospital. He was toddling before the accident, and then by the time we left, I believe he was starting to kind of toddle again. He had a nasal feeding tube a little bit for in the hospital until he could return to having breast milk or eventually having just regular food
So you were
too.
pumping and bringing it to him, like you were still like trying to say, and that's difficult to just pump and not breastfeed too. You know what I'm saying? Like to try to
Yeah.
continue the milk without him actually doing the breastfeeding. Because do you know what I'm saying? Because it's better when they feed rather than the pumping all the time.
Yeah, well, I pumped and I also got to breastfeed because I got to stay at the hospital because the nurses were technically like monitors, right? So
Yeah,
I could be there with him and breastfeed with him. He would sleep in those little metal cribs and they have the hospital.
yeah.
And in the morning, I would crawl into the crib with him and breastfeed him because he would kind of wake up. That was like the routine he had before, where he would wake up and breastfeed and go back to sleep. And so he was, as much as possible, he was living his routine that he used to have, but now he had this injury, and because of the brain injury and the stroke on the left side of the brain, it affected everything on the right side of the body. And it also affected his vision. So he has what they call bilateral hemianopia. He doesn't see midline to right in both eyes. And like 4 years ago now, he started getting seizures. So there's a lot of things that, that are stacked up against him, but he has a very resilient spirit and such a loving boy. He just passed me in height recently, which is
He's 12, right?
crazy. He just
12?
turned 13.
Oh, 13.
Just
Oh,
turned 13.
wow.
And he's, I'm 5'4" and he's almost 5'6" now.
Gosh.
So, growing a little mustache. He's in 7th grade. And
Love
so,
this. I love that age. My daughter's the same. Well, she's 15, so I'm going through the girly part of all of that, and so yeah, and she's now. I have to wash her hair because she can't do it because she's got cerebral palsy. So when I do her hair, I'm like, Piper, you're gonna have to squat because I can't reach you. She's taller than me now, and because her dad's 6'6", so she's getting to be she's gonna be tall. And so I'm like, I can't reach you. You have to sit. Like I'm gonna have to get her a chair or something. But so yeah, this is an awkward age for them, but it's also like it's all new because I have 3 kids, but it just feels because they're all 8 years apart. So this feels like my firstborn, even though she's my last. But
wow.
yeah, but man, I love this age. She's very she's smart too. You know how they get to be they're so much smarter than I don't know. It's hard to explain, but this is a great age. I really love this age. And so he's taller than you. That's awesome. And so is he legally blind? Is that what you would call it?
No, because his visual acuity is really good. Like his dad's vision is really good. I need glasses when I'm watching movies and stuff like that. His dad's vision, like he can see far really well. So I don't think he would be legally blind, but I think he would fall under like visual impairment because he does not see midline to right. So I don't, even if he didn't have the seizures, I'm not sure if he could drive. Maybe he could if they have like those special rear view mirrors to see all the way across or something. But you wouldn't know that he has a visual impairment that takes away 50% of his peripheral vision because he navigates the world pretty normally now. When he was little, he would run into things on the right side. If he was standing still and then he turned to the right, something was there. But now he knows he has to scan, so he's not running into things as much. But he's able to see things well, but just 50%.
Does your background in speech and language pathology did it change the way you approach like Che's recovery and all the things that comes with because I mean I don't have that background. I have a child development degree, but it's a little bit different when they reach a certain age. It's like, well, they're not developing anymore. I mean, do you think that having your background helped you with him?
Absolutely. Absolutely.
Yeah.
Because I knew I was already working in early intervention at that point, and so I knew what services he would need as soon as we left the hospital, right? So he was getting occupational therapy and PT and speech therapy in the hospital, but as soon as we got home, everything was in place. I reached out we have the regional center here in California, Southern California, and so I knew to reach out, and he got infant stimulation, he got physical therapy, occupational therapy, speech therapy. He was getting everything. And there's another organization called California Children's Services, and that's where the OT and PT were being serviced. Because they do a lot with like cerebral palsy as well, but a lot of like hemiplegia, which is like not something a lot of, I guess, regular early intervention physical therapy and occupational therapy people do. It's more like more of a very medical, a specific kind of thing rather than uh, working on pincer grasp or working on just standing and
Right.
stuff. And so, um, I wanted him to get speech therapy from someone else because I do speech therapy with him all the time, whether he knows it or not. But when I'm going to work, I want someone else to be there to do therapy with him as well. So it was a lot. But yeah, if If I wasn't a speech therapist, I wouldn't know what to ask for. I wouldn't know what he needed.
And you have, you knew of the some of the services. Like I didn't know. I had to find out the hard way of, my daughter also went to Kern Regional, by the way, in California. It's a great service. It helped her with all of the things you talked about. Like really they really helped her. Was there a breakthrough moment when you realized like he was like defying the odds? Like what were the doctors telling you his life was going to be like? And how did it actually turn out? I mean, were they giving
Yeah.
you like worst case scenario? And then you're
Well,
like, I'm gonna show you.
yeah, worst case scenario, they're like, he may never walk or talk. And that was heartbreaking because I was like, this small accident could reap such tragic, outcomes. And I was just like, what? That's not what he's gonna that's not gonna be him. And, he has grown, he's
Yeah.
gigantic, but we just
He's talking.
finished he's talking. Yeah, he's talking, he
Yeah,
has
he's
a
talking.
conversation. He loves music, he loves, singing. He'll play, like, the YouTube videos of songs with the lyrics because he wants to sing along and read the words, right? He's in a mainstream classroom with resource therapy or resource room for math,
Yeah.
academic stuff. And, he's still getting all the therapies. He gets PT, adaptive PE, occupational therapy, speech therapy. He did like 5 or 6 years of taekwondo. He did basketball. He has a pretty good jump shot. He only shoots with his left hand. He's a pretty good jump shot. A lot of kids his age, especially like the newer players, who have two hands, he'll probably make baskets more often than they will. Like he has a pretty good percentage for
Well,
his jump shot. Yeah.
that's awesome. I mean, my poor girl, she doesn't have hand strength very much, and so she couldn't dribble if she tried. But and it's funny. I mean, not funny, but I mean, all the things you talk about, I'm like, check, check, check. Like I'm all the things that my daughter is getting and doing. That's one thing about California is like, man, your kids can really thrive in the school system if you work it. You know what I mean? Like if you use it and you work it and you show up to every IEP meeting, do not let them do an IEP without you present because there are things that like I addressed and they're like, yeah, I think that's a good idea. And let's do that too. And so there are things that you can do to help your kids. And so be involved in their IEP is so important. So do not let that pass you by. It is your right. You have a right to be there. You have a right to do it via Zoom if you want. You don't have to be because it's intimidating to walk into a room with 20 other people and you're the only one. I used to bring my dad or my mom and because my husband couldn't go because he was always working in the hospital. And so I'd have to sometimes when I felt like I was being bullied into doing things for my kids, I'm like, come on, family. Like I made my dad come with me and just sit there and because he's a big dude and just so that I wouldn't feel so intimidated. But I digress a little because I just want parents to know, like, if your kids are struggling in school and they need an IEP, or you think that they do, you have a right for them to be there and to participate in all of that. And a lot of times, man, you're getting some really good um, like you said, PT, OT, speech, counseling, a lot of different things that they can do. My daughter, because if you have like too many math problems on the page, she freaks out and like it breaks down, like she just won't do it. So they'll fold the page over and they'll just grade her on the amount that she's able to accomplish. So if she does 12, then they'll grade her out of the 12 or whatever. And so there's modifications that can happen for your kids. So just so you know, I thought that was my daughter coming in.
Yeah.
She always knows when I'm talking about her. And I think, yeah, she probably did come in. She did come home already. So she likes to come in. She was like, who are you talking about? And I'm like, not you, but I always am because I'm always talking about her. So he started to find, like you said, he's got a jump shot. How is he doing socially in school?
Socially, it's hard, it's middle school. So it's hard
Yeah.
to make friends. We just had his birthday party and we invited like 7 other kids, which was nice. That he has some friends, he has some cousins around his age. So friends are difficult, to have good friends, especially in Los Angeles where nobody really lives near each other. When I was growing up,
Just so you know, people out there, you have to drive like 20 minutes to get anywhere in California. This isn't like I'm walking down to the bodega and you're getting, what you need. You have to drive like forever to get anywhere in this place. So if you don't have a car, you're screwed.
Yeah, yeah.
And by the way, when you throw a birthday party for a kid with special needs, you sit there and you're like, oh my God, please have people show. Please show. Please show. Because you go all out and you do a big spread, but you always want your kid to be like, have the kids come and makes them feel good. And so I always used to do that. Whenever I threw a party, I was like, oh my God, I prayed. And it always turned out. I always had a lot of people show, but we don't have any family. Like she has no cousins or nothing. So I don't have any family to fall back on. But anyways, I just thought I'd add that too. When you have a kid with special needs, sometimes you're begging to make sure that they show because it does affect your kids sometimes when they think that nobody wants to come to their party. So
Yeah, 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 absolutely. So yeah, and he's doing really well in middle school, and the staff really know him. So they know that he loves music. They know what his what's it called, his high ticket kind of activities are, right? They want to do if he wants to work for watching a video later or having some basketball time with somebody, that's something he can work towards. So they know what his strengths are. They know what he doesn't really want to do. He doesn't want to do some work. And what we learned this year is that he really needs to work on some functional math. So we're going to be working on like returning back to money stuff because he's like doesn't know how to count to a dollar sometimes or
yeah.
anytime. Can I
Yeah, I
step?
thought math was Piper's worst, but I
Oh,
guess it's her better
yeah.
subject. And then they'll push you in you know what? High school is going to be a whole different ball game, just so you know. My God. So Piper isn't she wasn't an inclusive class in middle school, and in high school she is not. They are different in high school. You'll find it's not like they care less. It's because that's not true, but they don't want to take away from the kids. At least in our district, that with Piper, because Piper will have meltdowns and stuff, and they don't want her to be teased, and they don't want to take away the from the other children. So she's actually not in an inclusive class. She's in like the special needs class.
Jess, I'm gonna run to the bathroom real fast. So sorry.
Okay.
Can you just pause?
Yep. We'll keep taking. We'll pause. 43. Every
I think I drank too much water
You
earlier.
scared my dog. You scared my dog with that noise when he sat down. He's like, "Rrr, rrr," like he was scared. You're all right. You're okay. Go back and lay down. Crazy dog. That's funny. Let's see.
Going back to when you're saying the IEP and everything, even though I'm a speech therapist and when Chase started in LAUSD, the school district, they knew I was a speech therapist and they still tried to lowball him on minutes and therapies and all this stuff. And we're to the point where I'm like, I need to get an advocate because they were, I'm like, they're trying to pull this on me, even though they know that I know the IEP. And so, like our regional center at Lanterman, the regional center, they had the Lanterman Law Clinic and they offered free advocacy. So,
like
advocates
they'll
can
come
cost
to
a
your
lot.
meeting.
Yeah, they'll come to your meeting. They
Yes.
they know the letter of the law. They will, scare the IEP team.
Yes, and like I said, you can do it via Zoom, so they can come in and be at their office, nice and easy. Everybody comes on, and they know that they have to mind their p's and q's, and they don't like. Okay, so just a story. Like my son, he had social issues, but he was super bright, like getting straight A's, and in a normal class, he just had social issues. Like he didn't get along with anybody. He has Asperger's. By the way, I've had IEPs for my stepdaughter who's 32, my son is 24, and my daughter's 15. So I've had like 30 years of IEPs. It's just been ongoing. And so my son, they wanted him to go into the special needs class because they didn't want him in the classroom anymore. And they took me to the special needs class because I said, I want to see what it looks like. And I went in there, and at this time, these kids were like hitting themselves in the face, and you could tell not they were very complex kids. And my son would totally, and they were doing like adding and subtracting, and my son was in like doing algebra. Like he was highly intelligent. And I was like, no way. Like, and I had to stand up and say, no, you're going to have to figure out a way to keep my son in an inclusive class, and, we're going to have to figure out a way to make this work because he's not going in that class. He won't learn. And so I fought back and I won. And they also try to give him a shadow, they called it, somebody who goes around with him, which my daughter needs because she's got all kinds of special physical needs. She definitely needs help in a lot of things, buckling her pants, like she can't do it herself. But my son had a person that was walking with him and doing stuff with him, and he didn't like her, and he would say mean things to her, or she would say mean things to him, and he would come home and I would question the lady, like, why'd you say that to my kid? Oh, I was just teasing and all this stuff. I'm like, you can't tease these kids because they're like, they take everything so literal. He's a concrete thinker. He's taking everything you say at face value. And I tried and tried and tried. I could not get them to take this person off of his thing, like off of him. Like they would not release her from him because they said they would have to fire her. And I go, no, 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 give her to somebody else and just give us someone different. And they said no. So I pulled him out of school and I homeschooled him. And well, actually, I took him for the rest of that year to a private school. And then the next year, a new teacher who was a first time teacher, she didn't know how to handle my son because he was up and walking around the classroom. Anyway, so I said, okay. So then I homeschooled him for 2 years. And then at fifth grade, we brought him back to the school system because we were in a different location. But so here's what I'm trying to get to is that you have to push back. And if it's not right for your kid, you have to make other arrangements because ultimately your kid's education is your responsibility as a parent. It is not the school system. It is your responsibility as a parent to educate your child. And if that's putting him in a public school, then that's what you do. Or if it's putting him in a private school, that's what you do. But you always advocate for what you feel is right and don't let them steamroll you into doing whatever they feel is right for your kid, because you're the boss. Just saying.
Yes.
Right?
Yes.
I'm just saying. I just thought that was a story. I think that's a story people need to hear because I feel like people get bullied a lot in the IEPs department when your kids got special needs and because you're at your wits end, you don't know what to do. You think that you have an idea of what you feel is right for your kid. And so you rely on them to help you. But then when they're pushing the envelope and they're not helping, then you gotta push back. So
Yeah, and in a way, the school is hoping that you don't understand the IEP enough. So you just sign the paperwork and they get to kind of move on. Because that's when IEPs are easy, right? When there's no controversy, no discussion, no debate about what the child needs or what the child has a right to, right? If we had a lot of parents when I was working in the schools, sometimes the parents didn't speak English, right? They spoke Spanish or something. And so they had that against them too. They would have a translator there, but they still didn't understand the IEP, right? So oftentimes they would just sign the IEP and it'd be done.
and
But
they push you for time too, because me, obviously, I like to talk. And so sometimes I have to tell them like what I'm asking them for and for explanations, and I'm asking them to please explain that better or whatever the case may be. And if it goes long, they're like, oh yeah, we need to wrap this up or blah, blah, blah. Then they try to rush through. And I'm like, no, no, no. If you guys need to reschedule and come back, we can do that. But don't push me through so quickly that I can't hear what's being said. And so if you don't understand it, just ask. But I see what you're saying. There are parents out there that are, like you said, they're not English learning or they're English speaking parents. And so English is their second language or third. And it's hard for them to kind of comprehend all that's going on. And like you said, they try to push it through
yeah,
and get it
you
done.
can speak perfect English and still don't understand the IEP. And they're not gonna, like they're not gonna handhold you and be like, well, you should really ask for this. So until you are educated by, somebody else who's gone through it, right? Or an advocate or somebody, so that you can understand the IEP and what you have the right to ask for, you don't know, right? So you're just gonna think it's a meeting and then when they tell you to sign something, then you're gonna sign it a lot of times. I had to one time, I think at our last meeting, we still haven't closed our IEP from June. We're still revisiting. We're going back tomorrow. Anyway, so
It's
um,
long.
it's a long time. I know it's going to be like our
Yeah.
third meeting, I think, or fourth
Well,
meeting.
this episode is gonna come out in July,
Yeah.
so we're talking really long, but that we're taping this at the end of October, so
Yeah, I know, it's crazy. But, like, they were trying to the RSP teacher was trying to read some passage that seemed like it was, like, in agreement, like, I agreed to everything. I said, "No, I'm not agreeing to anything yet, so send me home with the draft, and I will take a look at it, and we'll talk about it later."
right. Yeah, and they can be thick. But so you just gotta read it. And a lot of times if you're like me, because I can follow along and I'm like, yes, I agree kind of as we go because I agree on certain things because I know. She's had an IP like your son probably has since she was 3. So I mean, I know there's certain things that we're continuing to do, but then I push back and I'm like, she needs to learn to type. She needs to learn because nowadays these kids, they're pushing the buttons like this. And I go, my daughter needs to learn to type. That's something, a skill she might need as her, what if she can just, maybe she might just be a secretary. I don't know how in the workforce what she's going to do, but she needs to learn to type as a thing. So that's what I was pushing the last time, and the teacher's like, yeah, these kids do need to learn to type. And now she has a new teacher because her last year teacher went on because she's now a sophomore. She's like already a sophomore. So her last year teacher went on to teach adult special ed, and so she lost the one person that she was relying on. So now I'm going to have different teachers in the IEP, and it's like a new thing. And usually they follow in high school, you'll have the 1 or 2 special needs class, and they'll stay in that class all 4 years. And what's going on with Piper, and this is just something I can say for parents out there, if your child's young and they have an IEP and they're complex and they have special needs, they might be in Piper's situation where she won't graduate with the class. She'll walk with them and get a diploma, but she will not she won't get a diploma. She gets a certificate of completion. She walks with them. She gets the little cardboard thing. And then, but it's a certificate of completion. And then after 4 years, after her high school, she gets another 4 years that she can continue to go to this school, and they help her with a career and they try to help her get into a job of some sort. And so I'm like, well, I want her to maybe work for the city or the county, and she needs to learn to type to do those things. So teach her to type because that's where you get the best insurance. It's
Oh,
like working for the city,
yeah,
right?
yeah,
Or county.
yeah,
Or a
yeah.
hospital. She needs to, I'm just saying these are some life skills that she needs because she'll probably end up staying with me forever. I don't know, but um, that's what I'm thinking. Can I ask you a question for parents? Okay, how has this journey shaped you, like not just as a mom, but like as a speech therapist? Um, um, I'm sorry. I'm trying to read it, but then I'm trying to think of a better way to say it because I want to get this question out. Okay, so how has it shaped you basically now that you've now a mom of a special needs or a complex child, and you've now also you worked with other patients that have complexities, but how do you feel like as like did you feel like this was going to be your life? Like, you know what I
Yeah,
mean?
no, absolutely not. I did not think this was gonna be my life. Before, I had any children and my child, I was a speech therapist working in the schools, and I was very happy doing that. I was like, I'm so glad that I don't have a child with special needs because I can see these parents are exhausted. They're trying their hardest. I see these kids, I love working with them, but I just saw how challenging it could be having them at home or, having them 24/7, right? Because if they're not in school, they're probably with their parents, right?
Yeah.
And then I became a parent.
Did you think like, oh, I never want to have a child that has that problem? Or because let me just say, I've done that. My mindset when I was because I owned a preschool, and I had a lot of kids come through my school, and I would always tell myself like, oh, I'm so glad that I don't have a child that's like that, and I feel bad that I even said those words to myself, and I think God gave me everything that I ever said I never wanted for my kids. He gave me all of it, every single thing. The heart issue, my daughter has a heart issue, all the things, all these things that I used to say, "Oh, I had a child that couldn't talk, and this poor little boy couldn't really speak, and I felt terrible for him, and I worked with him the best I could, as a teacher, but he couldn't talk, and I'm thinking, I thank God my son at the time was I had a boy. I go, thank goodness Parker can talk, and now I have a child cannot talk at all. And I just feel like God gave me all the things I thought I didn't want because I think He was preparing you for exactly what we're living through. You know what I mean? Like, I don't know how to explain it, but He gives you what you can handle.
Yeah, absolutely. He does. He does give you what you can handle. And, you know, that thought of like having a child with special needs was it seemed overwhelming, right? Because you're just like, oh, I don't know if I could handle a child with special needs because, they just seemed like it was so complex. And I had my son, and then I was a mom. And I'm like, okay, he came out, he appeared normal, developing normally, and then he has his accident. And now all of a sudden he is a disabled child, right? Disabled baby. And in an instant, your life changes. And then, once you get over the overwhelm of like, this is my life now, and this is the life of my child now, it's like you kind of gain a superpower of perspective, right? Because now you can see the world. I always say you can see the world in 360 because as a therapist, when I didn't have a child, I would say, well, this is what you should do as a parent. This is how you should treat behaviors. This is how you should do this and that. And I remember talking about writing a book or writing something.
But because you have literature background. I mean, you got a degree in that. So did you put that to use?
Oh, well, I did recently last year.
Okay. Okay.
Going back to when I didn't have a child, my brother was like, well, no one's going to trust your judgment as for parenting advice because you don't have kids. And then I had a son and I was like, well, maybe I'll, write something. And then I have a disabled son. And then I have to put into action all of these strategies and ideas that I've been utilizing throughout my career. I need to put it into my daily life, right? I
Right.
need to use those strategies in order to get my son to understand and express himself and to have conversations and do all these things. And, I came to this point in my life where I was like, well, how do I create a bigger impact on the world? Like, how do I duplicate myself in order to help other people? Because working in early intervention, I saw so many kids that needed speech therapy, but they seem to understand, right? They seem to understand things. They seem to be physically sound, but they just were late talkers. And I came across so many children like that, right? There are going to be kids like Piper and Che and all these other kids that have actual speech therapy needs, right? They have something, a disability that they're going to absolutely need speech therapy. But there are all these other kids who seem to understand well, they seem to be physically sound that just were late talkers. And those parents, if they were just educated and trained a little bit better, I feel like those kids might not have needed speech therapy. And so I wanted to create a bigger impact and decrease the number of kids that need speech therapy and also help the parents with the kids who need speech therapy to understand what kind of simple strategies you could use at home and in your daily life to help promote language development and practice practice language every day in really simple functional ways. And so I thought maybe I'd be a professor and teach in a university, but I was like, you know what, let me take that money I would use to get a PhD and teach and apply it to like writing a book and make it be like a conversational handbook. So in the spring of 2024, I published my first book. It's called Play, Dumb and Sabotage. And it's a term that I use throughout my career of, we often will over anticipate a child's needs, especially as new parents, right? I'm sure you did it where we want to make sure that they're fed and they're warm and they have all their toys and they have everything they might possibly need. And oftentimes we do so much for these kids that we don't kind of see what the child is doing communication wise. Maybe it's reaching for something, maybe it's vocalizing, whatever it is. They
What
the
was the
the
name of the book? Play what?
Play dumb and sabotage. So it's this one right here.
Oh, I love the cover too.
Thank you. So
Because
it's
I'm gonna make sure that I put this in the notes too, so that people. Well, keep going. We'll get to that. I just want to make sure I wrote it down. I'm so sorry. Keep
Oh, yeah,
going.
no problem. The subtitle is "Mindfully Under Anticipating the Child's Needs and Creating Opportunities to Practice Language." So as parents, especially as new parents or grandparents or and teachers or whatever, we over anticipate because we want to make sure that the child is their needs are met, their wants are met, right? But oftentimes we do too much. And so mindfully under anticipating just means to kind of know what they might want or need, but wait and kind of give the child the space so they can,
That's
start
so
to
true.
communicate,
Because
right?
I am a helicopter parent. So I'm like the worst. What you're saying is exactly what you need to do, which is the opposite of how I raised my kids. I never did. I was that parent. Well, because my kids were, they're complex, and so I thought, oh, I got to jump in and save them, and I was it to their detriment is what I was doing. And so if you just let them fall down and then then you recognize like, yeah, that hurt, huh? I'm sorry about that. Like acknowledge that they hurt and then let them recover. Like, they learn to recover on their own. You don't have to quickly put a band-aid on them. You know what I mean? So
Yeah,
sorry.
yeah. Or like like I had this one little girl, she was a really well-behaved baby, really well-behaved toddler, never cried, never whined, really. So the parents thought, okay, well, we're doing a great job. We've met all of her needs. She's fed, she's dry, she has toys. And then they're like, well, why isn't she talking? Right. So at after age 2, she started speech therapy with me. And once we started doing different strategies, she started talking right away. And the mom, she said, well, I didn't know I had to interact with her that much because they just thought, her needs are met. She's happy. They didn't know they had to get down to her level and play, that they had to sing songs with her, they had to read books with her, because if a baby's crying, of course you're going to attend to them. But if a
Right.
baby's not crying, then the baby seems content, right? So oftentimes parents don't understand that there needs to be a lot of interaction, or the parents are being helicopter parents and doing so much. And they're like, well, they're not, they're fine. They seem like they're not crying. They're happy. But I'm like, because the child never has to ask you for anything.
That's me. Yep. This girl. My daughter, she had a really good vocabulary. She was 3. She was going to the Kern Regional Center, like the Richardson Center was a preschool for special needs children, and so she was going there, and we knew she wasn't putting, she'd put one. She wasn't really putting 2 words together. She was saying one words. She had a whole bunch of them. We wrote them all down. Every time she say a word, we wrote it down, feverishly, like, oh, she said that word. She said this. She knows how to say that word. And then as soon as she got into speech, it took her about 1 year, but she was starting to say 3 words. And it were starting to, that speech was, it was working for her. But we found out she has other problems. We don't understand why, but she just has got some language issues. But yeah, she was delayed in her speech. And a lot of times too, people, you got to make sure that if they're delayed in other things too, that to get it looked at, not just, and I had to go hand in hand with my mother into Kaiser and demand that they give her an MRI because they weren't going to do it. They kept saying, oh, she'll get to it. It's 2.5. She'll do it. And it was 2.5 when we found out she had cerebral palsy via the
Oh,
MRI.
wow.
Yeah.
Really? Oh,
Yeah. I
wow.
kept I kept going in and telling him like, she's not doing this, she won't eat and she won't, I couldn't get her to stage 2 baby food ever. Even when she was trying to eat it when she was 5, like it couldn't give her to stage 3. She wouldn't do it. It had too many chunks in it. The eating issue was a whole thing. Language was a whole thing. But during that time, she wasn't really barely walking and some other things. So I basically said, you better do it because there's something not right. And I
Yeah.
know it. And mommy's spidey senses were telling him, like, we need to figure this out. And so I was right in this case. But if they're, don't always just rely on the doctor. Yeah, because they're just trying to get you in and out in 15 minutes. And it's hard for parents because they don't write down the questions that they want to ask the doctor. And then they feel like, oh, when they leave, they're like, what did he say? Like, what did we talk about? Like, they don't know. But so you have another book though, correct? Did
Just
you say
this
you had
one.
2 books? Oh, I thought you
Just this
said
one.
you wrote. I thought you said you had written another one. Okay, I'm so sorry.
I had thought about writing a book earlier in my career, and my brother had told me, "No, people are not gonna trust you because you're not a parent."
That's
So
not true.
I didn't write that.
But what I'm saying is, your book is kind of interesting that you wrote a book so that you would have less customers as a speech pathologist.
Well,
You know what I mean? You're like, don't you trying to get some more customers here? No, no, you're trying to make it so that that it's possible to start them early and get interaction with the parents to help them, and
yeah,
maybe they'll
yeah.
need less help in school.
Yeah,
And then what
someone
comes with having to have special classes, or you have to go to OT, or it's stigma, and you're in school and the other kids are looking at you. You're now the special kid that needs speech. Not that that's terrible, but you know what I'm saying.
Yeah, people ask me someone asked me, "Oh, aren't you afraid that if this book becomes popular that you're gonna be out of a job?" And I said, "Absolutely not." I'm like, "Do you understand how many kids need early intervention speech therapy? I feel like there are way too many kids that need it, and there are so many kids in that target area of they understand and they are physically sound, they're just late talkers. And if we could get rid of those kids and we have more speech therapists to really address the kids that absolutely need speech therapy, there's I'm never going to be without a job, but I
Yeah.
wanted to create a greater impact and duplicate myself in the best way possible and educate parents because you guys go to parenting classes to learn how to diaper a baby, swaddle the baby, feed them the bottle, but you don't learn how to introduce language or what strategies are simple and practical that you can use every day to promote language.
Can I ask you a question? What
Yeah.
happens? What for a parent that? What are some early signs that? And what age would they need to start being concerned for their kid if their kid isn't? Like me, my daughter was two, and she was like, she'd say one word, but it wasn't like she wasn't talking. And I don't know. It's funny because I had a child development degree, and I was like, okay, whatever the doctor said, I was like, okay. It took me a while to get some thick skin and learn to advocate for my child, but it took me 3 kids. On the third one, I'm getting it right now. But but what are some signs that you might know that we could tell parents like these are things to look for, like if their child isn't talking, and what age would that be?
Yeah. So, when they're babies, right, they get hearing screenings, but in case something is missed, if you guys are playing with rattles or something and the child's not turning to sound when they're baby, in that first 1 month or so, month or 2 months, then they can check their hearing, recheck their hearing, right? But you would expect the child to start babbling, right? 5 months, between 5 months to 6 months, 7 months, 8 months. And then they start doing this intonation of sounds very similar to adult speech. And about 1 year, right? So anywhere between 10 months to say 13, maybe 14 months, you'd expect them to say their first real word, which, a lot of times will be mama, baba, papa, because those are
No.
bilabials. Not yet. But those are the sounds that, their lips are kind of together. They can kind of see that. So sometimes people, oh, mama was their first word, but they're really just babbling. They're going ma, ma, ma. But it's not like if they go mom or ball or up or dad or car, but it's meaningful. Like they mean it. They're consistent. They mean it that they want that or they see that or whatever it is. So about 1 year, you're going to have them say their first word. And then, between 1 year and 2 years, they're going to accumulate a lot of single words. And by the time they're 2 years old, you would expect them to string together at least two words. And by the time they're 3 years old, they would be saying 3 to 5 words. So if they're not saying their first word by 14, 15 months, that's kind of a red flag. Keep an eye out for that, right? Because you don't want to wait too long because some parents will, be hopeful. My child's going to speak. I know they're going to speak. They're in
The
denial.
doctor says, "Oh, give her time, give
Yeah,
her
yeah,
time,
yeah. And then the
give her
doctor doesn't
time."
see them for a while, right?
Right,
And
right.
so by the time that the child gets referred for speech, oftentimes they're 18 months to 2 years old, and then they have to wait to get evaluated. Sometimes and they're not like, they're not getting speech therapy until two and a half. And then early intervention speech therapy ends at 3. And then from there, they can go on to school age and get services in the schools if they qualify, right? Because sometimes kids, once they reach 3, they still need a little bit of help, but they don't need that much help where they're going to qualify for special ed. And sometimes school districts now, especially, they're like, well, they don't seem too bad, but they still haven't met their milestones for age 3 quite yet. So I would say definitely the biggest red flag is if they're not babbling, 5 months to a year, if they're not babbling, making different sounds, and if they are not saying their first word by 13, 14 months, maybe 15 months.
When Piper was about 2.5, 3, her one thing that she'd couple I was gonna ask you about repetitious stuff because she'd always say the only she wouldn't say a lot of things. She wouldn't say, "I love you." Not that was too many words but she would say, "No, thank you," all the time. "No, thank you." That's like her one thing that she knew how to say, and so if you because she we didn't know this, but and I think now it's evident because she was like, "No, thank you," meaning like, "Oh my god, no." Because she has anxiety like through the roof, like it's crazy anxiety, like clinical, like she needs to be medicated probably. But such crazy anxiety, even as a little girl, was like, no, no, thank you. Like, don't do that. Don't lift me. Don't this. Don't any of that stuff. And but she said it was like repetitious. That was the one thing she did know how to say. I mean, is there a thing where if the kids are saying just the one phrase all the time that you should be concerned, or it's just something that they got stuck in their head, or does that make sense?
Yeah, I would say, sometimes when they say multiple words, right? So, "No, thank you," it seems like it's a three-word utterance, right? But sometimes they learn it as one thing. Does
Yeah.
that
No,
make
thank you.
sense?
Yeah.
"No, thank you." Like, some kids
Yeah.
learn, "I love you," as "I
Yeah.
love you, I love you." They learn it
Yeah.
as one thing rather than 3 different words. So
Right.
that could be, like, her one word. Like,
Yeah.
it's one word to her.
I kinda
Uh
get what you're saying because at that time, she really was saying only like, she was trying to say like, she would say happy birthday, she'd go, "Happy" or she'd go, "Hi," and then Earth Day or, whatever, she wasn't really saying the whole word, but it was like she really tried. We were like, "Okay, say it," we really did try the best we could with her, but, it is what it is, and for the parents out there that are struggling, you have resources, you maybe not know about it, so you just have to reach out. And this book sounds like a good useful tool, right? Play dumb and
Sabotage.
sabotage.
I know.
It sounds like a useful tool that you can maybe, get a jump start on learning some techniques that could help you with your when you're because I know moms are, what I always say moms and dads, but honestly, it all falls on the mom. Hate it is true. Everything falls on you as a mom, and you have mom guilt because you can't do it all, and you don't know where to start or you don't know the tools to help you. So this book is out there to help you. And I know I've taken so much of your time today because I
No, I love it, I
like
love it,
I'm
I
picking
love
your
it.
brain because I'm just so interested in your whole story. I can't believe what you went through. I'm like, I cannot freaking believe it. And I just don't understand our system out there where you have these parents that are on drugs and the kids can, they never take the kids away. But then you have a loving family and you just rip them apart. You know what I mean? It just, I cannot overcome it. It's driving me nuts. I'm so sorry that that happened to you. And, yeah, I mean, I know they're there as a way to protect the child, but obviously, you're putting together all the things. I mean, I'm just going to get started all over again, but you're putting together all the things for your kid when he gets out of the hospital. I mean, isn't that just case in point that you're trying to do what is best for your child? You know what I mean? Like you're getting him all the doctors, you're getting him all the right help he's going to need. I mean, you're doing that, not them, you know.
Yeah, no
Anyway,
one no one in the hospital was like, "Okay, this is what he's gonna need after he leaves here." They don't do that. I wasn't ever approached with that, and thinking about that, I'm like, every parent who is going or has gone through my situation or something similar, I'm like, they don't get guidance on what happens next. Which is pretty scary, so a lot of kids will have delayed therapies because the parents aren't informed, which is really sad.
yeah. I mean, both my kids were born and they both were in the NICU unit. I don't know what it's like to bring a child home normally, like after birth. I don't know what it's like. I know what it's like having a child in the hospital. My daughter had open heart surgery when she was 5 months. So, having them just pluck her out of your hands to take her to the surgery room was devastating. So, I cannot even imagine where your mind went when they were intubating him, Che, sorry, when they were intubating your son, because it's almost like I can totally see where it was like you were numb, like you froze, like you didn't know how to react. And so for somebody to interpret that you are a cold mother is just insane to me. And so I don't know why. I just want to say I'm sorry on behalf of all moms that happened to you and your
Thank
son.
you. Thank you.
And Sergio,
Surge.
Serge, because I know that had to been not good for your relationship as well. It's probably put a big old strain on it. So, but I just love your story. I don't know why. I'm enamored by everything about your story, and your book sounds amazing and helpful and important for parents out there. So, where can they find your book?
Well, it's on Amazon, but if they want to go to my website, there's links for that there. They can go to playdumbandsabotage.com and they can join my email list. They can get some information about events that I'll be doing. I'll have an online course. By the time this episode is out, my online course will be launched. It's going to be geared for 3 different levels. One level is going to be for parents and caregivers. The next level is going to be for educators and other therapists like OTs and PTs and such. And then the third level is going to be for speech language pathologists and speech language pathology assistants to kind of get everybody, on the same kind of page and helping other people in the world.
Also, for all of you out there listening, if you go to my website, justsayin.net, and you scroll down to this episode and you tap onto Jeaneen Tang's name, it'll take you directly to her website. And that's just another way to find it in case you can't find it or you forget or whatever. Go to podcast, go to my website, go to podcast, scroll down, find the episode, click on her name. All of her information will also be listed. So you will have no problem finding her and finding her book, Play Dumb and Sabotage, which I love the name. The name sounds amazing. And I love that Che is thriving and playing basketball and singing and being happy. And that's just proof in the pudding that you are a great mother. And they were wrong.
Thank
Just
you.
saying.
Thank you.
And I wish I wish you well. I hope you land a really big part, because I think that's awesome that you you have a little side whistle that you're
I
an
do.
actress.
I know. I love it.
I think it's amazing, and I bet you're just a gem to your clients. And I just really want to thank you for coming on and sharing your story. And it's not an easy story to tell, I'm sure. And but you know what? That's what makes us humble in life, and it's important to tell our story so other people that might be suffering through stuff will see that, like, they're not alone, right?
Absolutely. Thank you for having me here.
Well, thank you. And everybody, remember, there's only, one world out there. Let's be good to each other and take care. All right. Have a great night or day, whatever it is for you. All right. Bye.
Gather around when the sun dips low, talking about the days we used to know. VCR tapes and dial-up tones, raising kids living with achy bones. Leather jackets and big hair days, now it's carpool lines and PTA. Neon dreams turn into schoolyard fights, but our hearts glow in retro nights. We are Gen X, living both worlds. From cassette tapes to a digital world. Parenting now with a nod to the past. The retro love we know will last. We are Gen X, living both worlds. From cassette tapes to a digital world. Parenting now with a nod to the past. The retro life with arcade dreams. Feeding families with a pizza slice, telling tales with a side of advice, laughing at the